Hey everyone, my name is Markus Wiegel, and I'm a senior at University League School. For the past year and a half, I've been researching about a cancer treatment called proton therapy. In this video, I'll discuss what is proton therapy, the accessibility of proton therapy, and the affordability of proton therapy. Throughout my research and classes at Liggett, I always found that having a visual aid helped me understand things easier. So for my product, I chose to learn how to make 2D animations of my own. You'll see them throughout the video. Let's get started with what actually is proton therapy. Proton therapy is a type of radiotherapy that uses a beam of proton particles to treat cancer. This is the machine used to administer proton therapy. It is called a cyclotron. Inside of this machine, there are countless proton particles which are represented by these orange dots. The cyclotron moves them around inside until they are fast enough to be shot out as a beam. Now let's discuss how it actually treats the cancer. Most cancers are tumors. Tumors are made up of cancerous cells. Cells are made up of molecules, which are made up of atoms. Orbiting those atoms' nuclei are electrons. Because protons have a positive charge, electrons have a negative charge. Whenever a proton moves by an atom, it attracts the electron, taking it out of its orbit around the atom. This process is known as ionization. This significantly changes the characteristics and abilities of the atom. Because atoms make up molecules and molecules make up cells, ionization heavily affects cancer cells, causing damage to them. While normal cells can usually recover and repair themselves, cancerous cells cannot repair themselves as easily. Therefore, with enough protons being used to do damage to cancerous cells, the tumor can be eradicated. Proton therapy shoots a beam of protons at the cancer cells, thus causing ionization to happen and the cancer cells are damaged. This works similar to other treatments, except for the fact that this uses protons instead of photons. The photons used in standard treatments have less controlled energy, allowing them to be more destructive to both cancerous cells and non-cancerous cells. On the other hand, the protons used in proton therapy have more controlled energy. Because of that, the proton beam can be much more narrow than other cancer treatments. Protons have a unique property called the Bragg peak, as shown by this graph. This shows the amount of energy deposited by protons throughout the distance they travel. As you can see, they deposit very small amounts of energy at the beginning up until one spike at the end, and then after the spike it goes back down again. In the proton therapy operation, this beginning part of the graph, where their energy deposited is very low, corresponds to the beginning of the operation, when the proton beam is traveling through other parts of the body on the way to the tumor. When the graph skyrockets up is when the proton beam reaches the tumor. This is where almost all the energy from the protons is deposited. After the peak, the graph falls down to zero. What this graph shows as a whole is that the proton beam releases little energy when releasing the body, a lot of energy at the tumor, and then no energy in the rest of the body after the tumor. When energy from protons is deposited in the body, this can cause radiation. Due to the more narrow beam and the Bragg peak property, proton therapy deposits significantly less radiation into the body than other treatments. Whenever cancer is treated with radiation therapy, there's always a chance of even more cancer or secondary malignancy developing in the area exposed to the radiation. Proton therapy is a more precise form of radiation therapy, meaning there's less of a chance of that happening. Secondary malignancies develop over time, so children have a much higher chance of developing secondary malignancies than elderly patients. Depending on the cancer, proton therapy can reduce the chance of a secondary malignancy developing by up to 26%. This is much lower for elderly patients because they don't have as much time left to live as children do. So generally speaking, the younger the patient, the more use they get out of proton therapy. At first glance, it might seem like proton therapy is more expensive than other forms of radiation therapy. And this is true. Depending on the treatment, proton therapy could cost as much as double other forms of radiation therapy. However, as stated earlier, proton therapy has less side effects than other forms of radiation therapy, and so the difference in cost changes over time. One study compared the cost of proton therapy and X-ray therapy on 5-year-olds with medulloblastoma. It found that although the initial cost of the proton therapy treatment was more than X-ray therapy, when taking into account the cost of treating all the other side effects, the total cost of X-ray therapy was 2.6 times more than that of proton therapy. On the other hand, one study compared the cost of proton therapy and IMRT on 60-year-old men with prostate cancer, and it found that proton therapy was still more expensive. So it is unclear when exactly proton therapy stops being more cost-effective. Nonetheless, it shows that proton therapy is more cost-effective the younger the patient. I hope this video was informative. Thank you all for watching.